fertility. But then also something that we don't really talk about a lot, birth control, contraceptives. Can you speak about the connection between birth control pills or other things that we use and cancer, and breast cancer specifically?
Men can get breast cancer, and so if a man develops a lump in his breast, it definitely does warrant attention.
Now, we've been, over the course of Breast Cancer Awareness Month, we've been tackling it from various angles. We've spoken to people who have been diagnosed, people who have gone not only through diagnosis but through treatment, people who have had double mastectomies. Yesterday, spoke to somebody who organized a flash mob up the West Coast, a bunch of women who got onto the beach and just showed the universe what it is that they have just as part of the conversation, and a group of women getting together talking about their breasts and health and the approach towards taking care of just a vitally important part of their body and of their identity. So as many angles and as many conversations as we can, that's what we're looking to do over the course of Breast Cancer Awareness Month. So it gives me great pleasure to say good morning to Dr. Liani Smit, who is a medical geneticist. Good morning.
Good morning, Aidan. Thank you for having me.
Absolute pleasure. What is it that you do? I can kind of piece together from your title, but what exactly do you do?
So that's a good question, because a lot of people, including medical doctors, don't know what I do. So I'm a medical doctor that is specialized in genetics or hereditary conditions. And often people have this very glamorous idea of someone working in a state-of-the-art laboratory, working with test tubes and microscopes, and it's actually not that. So I consult with individuals and families who either have or are at risk of conditions that may have a hereditary or genetic component. And obviously cancers, including breast cancer, is one of those conditions that may be relevant to what I do.
All right. And why would you say it's so important for us to have an understanding of our genetic makeup as part of that arsenal of tools that we have to try and look after our health?
So as we are learning more about genetics and what the influence of genetics may be on our health and disease, we are really learning that it plays an integral role to a lot of the health problems that we may face in our life. And cancers are one of those that may be influenced by hereditary factors in our body.
And in your experience, cancer is something that occurs, and it's a random thing. It's something that occurs as a result of lifestyle or things we do to our body. Or would you say it is largely driven by a genetic makeup?
So most cancers are what we call multifactorial, which means that there are underlying genetic risk factors in combination with other environmental, lifestyle, or hormonal factors that actually triggers or drives that cancer. But we generally say about 5 to 10% of cancers, including breast cancer, may be caused by a strong underlying genetic or hereditary component. So most of the time, even if you do have a family that have multiple cancers, maybe also if it's cancers occurring at a later age in life, those are more likely to be sporadic cancers where, yes, there are underlying genetic risk factors, but those aren't the only factors that's determining the cancer or causing the cancer to happen. And then you do have that smaller proportion of families where there may be a strong underlying hereditary component. And those are obviously the important ones where it is useful to identify those peoples and families that are at risk.
All right, let's go back to breast cancer. Is there a thing such as cancer, and cancer presents in different parts of the body? Or is there a specific thing like breast cancer, which is different from colon cancer, which will be different from lung cancer?
So cancer is basically just cells in our body that start going a bit haywire and not listening to our body's usual control mechanisms that's telling them to stop dividing uncontrollably. So they start dividing and start doing their own thing and doesn't listen to our body anymore. So, and those cells can start happening in any tissue or part of our body. We find that again, there may be some genetic risk factors that are linked. So, for example, with breast cancer, there is a link to ovarian cancer, to prostate cancer. It's not necessarily linked to colon cancer, but there may be other genetic factors that actually may cause or drive a colon cancer.
Right, chatting with Dr. Liani Smit, who is a medical geneticist. The question everybody's asking on the WhatsApp line, how do we know if we are at risk? And that's the bit we're going to sink our teeth into on the other side of the Lighthouse family. So let that one just settle, let it land a little. I think there was a lot of info there. Who is talking about, I suppose, the genetic approach to understanding breast cancer. And a lot of questions are coming in just generally about breast cancer. And I don't want to touch on any of those because I think we'll have other medical professionals that will talk about cancer and breast cancer particularly as a medical phenomenon. This time round, it's all about the genetics thereof, right? And maybe let's take a voice note at this point, which I think sums up what many people might have experienced and possibly are thinking and feeling.
Hi, good morning, Aidan. I would like to stay anonymous. I just wanted to ask the question, is cancer, is it genetic or hereditary? Because my father and quite a few of his family, his uncles, his cousins died of cancer. And every year I tell myself I want to go for tests. But it is as if I am in denial and I'm already 75 years of age. What do you think, or what will the answers be from this person? Thank you very, very much.
So there's a family history, which is one way of. I mean, you almost don't even need the genetic testing if you have an accurate record of family medical diagnosis and so on. But we therefore almost paralyzed by fear. We know it's there, and I'm actually not going to go and look because I'd rather not know. This is what many people do.
So you hit the nail right on the head there. And I think we also need to appreciate that people are different. Some people want to know, other people don't want to know, and that is okay. But obviously there is the message that we want to spread is that there is a lot of benefit in knowing. And as you also said, Aidan, I mean, sometimes you don't need a genetic test. Sometimes your family history can already provide a lot of clues that yes, there may be an underlying increased risk in your family for cancer. That's not necessarily the case in others. But things that we look at, so when I consult with patients and they come with that question to me, is we start off by doing a very comprehensive 3-generation family tree. We ask about everyone that has had cancer in the family. We ask about what cancers they had, what the ages are that the cancer started. And that often gives us a clue as to whether there's a high risk for a certain underlying genetic cause as compared to just multifactorial causes, as I mentioned before, which are due to other factors like hormonal factors. So specifically for breast cancer, the main risk factors are actually being a woman, which we do not have any control over, and also increases in your age, which again, we haven't figured out how to reverse aging yet. So those are our biggest risk factors. And then there's also other factors like hormonal influences and lifestyle. So maybe carrying a bit of extra weight, maybe not having the healthiest diet, and exercise, drinking excessive alcohol. Those are all risk factors that do come into play. But just because someone also has certain risk factors or has a family history still doesn't mean that they will definitely develop a cancer. And even in families where we do identify that there is a high underlying genetic risk, often it's still not as dooming as people may think it is, because there's hardly ever a genetic test that will tell you, okay, you have 100% chance of getting cancer in your lifetime. But it may say that your risk is higher compared to the general population. And what we then do is that we actually do implement screening and testing earlier than what we would do in the general population. And we all know that detecting cancer early has a lot of benefits in terms of making it more treatable.
Absolutely. We'll keep the discussion going in a sec. First, though, a traffic update. Liani Smit is with us. She is talking about screening and genetic testing as part of trying to understand this phenomenon of breast cancer against the backdrop of Breast Cancer Awareness Month. She is a medical geneticist, and I think the thing we can take away here, doctor, and just help me understand if I've got it correct, is in some cases there might be a higher risk, or there are risk factors that would probably impact more people, or people more than others. But there's no way of saying absolutely you're going to end up with cancer. I think people, and I'm looking at a lot of what's coming in on the WhatsApp line, people are wanting like absolute answers. Will I get? My uncle had it. Will I definitely have it? And genetic testing wouldn't give you that, would it?
No, so even in people who do end up having a highly genetic cause for their cancer, so the most well-known genes are the BRCA1 and 2 genes, which does significantly increase your lifetime risk of cancer. But even so, even though it is a high risk when someone tests positive, we'll say, well, as a woman, you have about a 40 to 80% chance of getting breast cancer in your life, which is significantly higher than the general population risk of about 10 to 13%, but it's still not 100%. So when someone does, however, screen that high risk, and that's probably the highest risk that someone can have, we will give them options to reduce that risk, or then, as I said, intensified screening to detect cancer early to allow that it's more treatable.
Doctor, as one of those measures, would you suggest getting maybe a double mastectomy? Let's say I had those markers and genetic history, and now that's discovered. Would you then suggest I should get that mastectomy just to be safe? And would it help me?
So that's one of the options to reduce risk if there is a highly genetic cause in your family. But again, that is accompanied by extensive discussions with yourself, with your doctor, with a genetics professional like myself, or a genetic counselor. And ultimately, it is the individual's decision if that is something that they'd want to do. So also just to clarify, obviously that's not the case for most cases where there is a family history, only in cases where there's a very high risk. And ultimately, it's a very personal and also emotional decision.
Yeah, 100%, because it's such a symbol of femininity. But then also something that we don't really talk about a lot, birth control, contraceptives. Can you speak about the connection between birth control pills or other things that we use and cancer, and breast cancer specifically?
So we do know that for many types of breast cancer, there are hormonal factors that do increase the risks. And obviously birth control pills, as well as hormone replacement therapy that women may take in menopause, do contain hormones. So there is some evidence that those therapies may increase risks for breast cancer. And there's definitely in certain people, especially in older women that have had breast cancer, or that are at high risk, that you may not want to prescribe hormone replacement therapy. But there's also sometimes the risks for other cancers, like ovarian cancer, is actually reduced when you are on birth control. And I think it's true for any medication that you are on. There are benefits, there are side effects potentially, and it's just weighing up the risks versus the benefits.
All right. Haley on the WhatsApp line asking, why are more men presenting with breast cancer? I never knew men could develop it. It's always been there. I think it's perhaps not as common a phenomenon. And how much of that would be linked to genetics?
So, that's absolutely correct. So, men can get breast cancer. And so, if a man develops a lump in his breast, it definitely does warrant attention. When a man presents with breast cancer, we are immediately more concerned that there may be an underlying hereditary cause because it is so rare. But again, it isn't true in all cases.
All right. We'll keep talking on 082 222 1049. Any questions for the doctor? And we're talking specifically around your genetic predisposition to either developing cancer or having had cancer in the family? And then ultimately, how does one go about getting yourself tested? What does the test involve and how much does it cost? These are questions that people want answered. We'll pick those up on the other side of a full info update. If we go about testing, who should test and what's the procedure? What's the format for this testing?
So preceding any testing, it is actually really important for people who want to undergo testing to have a consultation with a genetics professional. So someone that can sit down with them, explore their family history, establish what their risk likely is for having a hereditary cancer versus one of these more multifactorial or sporadic cancers. They can talk them through what the testing would entail, what the costs would be, etc., and what to expect from the results, whether it's now positive, negative, and sometimes we still do get uncertain results. When it then comes to the actual testing, we do prefer to start with someone in the family that either has cancer or that has had cancer.
Any form of cancer?
So it depends on what's relevant. Also you want to test the person in the family that is most likely to have a hereditary type. So let's say there are multiple people with cancer. You maybe have a sister that has had breast cancer in her 30s, but you also have a mom that has a cancer at 70 and a granny at 85. You want to start with the youngest person. We do expect that to be the person that if there's a hereditary predisposition, you're most likely to detect it in that person. So you'll start with the person most likely, where you're most likely to find something. So there's various different options available. And again, it depends from family to family and what's going to be most applicable. And if you do find a hereditary predisposition in that person, then you can actually offer a more predictive kind of test then to other at-risk family members to determine their risk. So sometimes, however, an affected person isn't available or is maybe unwilling to get tested, then we can still start and test people that are unaffected and want to know more about their risk in the family. But there are limitations to that approach. And again, that is something that the genetics professional will highlight during the consultation.
Do you get tested at one point in your life and it holds true for the rest of your life? Do you get tested at multiple points where things will develop and things will show up later on?
So our genetics don't change. It is stable, but the technologies improve. So maybe 10, 15 years ago, we actually had very limited genetic tests available, maybe only testing 1 or 2 genes. When now we're at a place where we can actually test hundreds of genes. So if there was a test in a family 15 years ago, they didn't find something, but only 1 or 2 genes were tested, then actually, if you are concerned, you may want to consider doing a newer test. But your actual genes won't change in your lifetime.
Okay. And then two more things quickly. What does the test involve? Everybody wants to know, how does this testing happen? Do you prick us? Do you take an epithelial swab? Do we give you blood? What happens?
So, every tissue in our body has DNA in it. The most common routes are either taking a normal blood test, as you would do for any other blood test. Some may involve a saliva sample or a buccal epithelial sample. It just depends on which laboratory is doing the testing and what testing you're requesting.
And then the $1 million question, what does this cost? I'm not going to hold you to an exact number, but ballpark, what are we looking at here for these tests?
So genetic testing is very expensive due to the technology used. And the prices vary a lot. Again, it depends on now how many genes you are testing. Are we doing a testing locally in South Africa? Are we sending it overseas? Sometimes medical aids may reimburse it, especially if it is a person who has cancer and that has a medical aid where there's oncology benefits activated. Medical aids may fund that type of test. You're looking at anything ranging from a few $1,000 to 10,000 Rand and upwards.
All right. And where can one have this done?
Yeah. So with me being at Mediclinic Precise, if you're interested to learn more or to get information about where to access a genetics professional, because again, as I emphasize, it's really important not to just go out, approach a lab, say you want to have a genetic test for cancer. Most labs will also just turn you around and say go to your doctor. You can reach out to Mediclinic Precise by visiting our website or sending us an email.
And then somebody's saying, is it like a one-stop shop for testing? Can I test for a whole bunch of things? So, I mean, you know, sometimes you're going to have blood work done and they can use that one vial to test multiple things. Is it the same in this case? Or are we talking about if you're doing a genetic test for specific things around breast cancer, it would only detect that?
So with genetic tests, it really just depends on what you're opting for. Generally, with the type of testing that we would use in a medical or diagnostic setting, it is usually aimed at the specific disease that you are looking at. So, and again, it's not as broad as something like an ancestry test or a nutritional genetics test. It is really focusing at identifying really rare genetic changes that are putting us at increased risk, as opposed to genetic factors that are actually quite common in the population and that a lot of us have.
Are you able to give us a sense of how often people test, or how many? I mean, are we talking a few thousand people annually in the country? Are there tens of thousands who do these kinds of tests? I mean, is it something that's catching on? Are you seeing an upward spike in people presenting themselves at facilities like yours?
I think it's hard to give any absolute numbers because there are so many role players in South Africa, but there's definitely greater awareness amongst both the general public and also amongst healthcare professionals and people like oncologists, GPs, who are picking up risk factors in people or families at risk more regularly, and that are referring now more than before. And I think there's also genetic testing, as we just said, it is still very expensive, but especially if medical aids are funding it, it's not completely unaffordable. So often there's been this thought or this stigma that genetic testing really is not affordable at all, so there's no worth pursuing it, but that has really changed in the last few years.
All right, I'm going to park it there for this morning. Dr. Smit, thank you very, very much. Most informative. What we will do is clip all of the bits that we've asked the doctor, make it available as a podcast, and you're able to share. You know, I mean, it's just another weapon in our arsenal of approaches. Genetic testing might be that. I mean, diet is one thing, exercise and lifestyle and everything else. But you know, at certain points there might also be the need to understand what's going on inside of us and understanding what our genes and our ancestry and how that's impacted on us, our genetic makeup, how that impacts the possibility of us developing cancer. You sometimes find people who are 100% healthy. They eat lettuce, breakfast, lunch, and supper. They still end up with these things, and nobody can explain it. Well, sometimes it's just what is in the family. You know, we always hear it's in the family. It's in the family. Well, these tests will determine just to what extent it is potentially going to cause damage in the family. Dr. Liani Smit, who is a geneticist, a medical geneticist with Mediclinic Precise, on Heartbreakfast with us this morning.
Take amazing pictures and enjoy.